COVID vaccines were first available in the United States back in December, mid-December. And the first person to get one, a nurse in Long Island, New York. The first to get a COVID vaccine in Idaho, a doctor in Madison County. Seems logical since healthcare workers work on the front lines with COVID patients, and that puts them at higher risk of contracting the virus. It would be logical to think all healthcare workers would then fall in line and jump in line to get their shots. But that hasn't exactly been the case. In fact, according to a Washington Post Kaiser Family Foundation poll, only 52% of healthcare workers across the country have gotten their first dose. And more than 33% say they're not really confident that the vaccines were adequately tested. So what's the solution? For some hospitals around the country, it's a simple one. They've chosen to make them mandatory. That hasn't happened in Idaho, though, at least not yet. Katya Stepovic spoke with two of Idaho's largest healthcare facilities to ask this question: are our healthcare professionals getting the vaccine?
How can you not be vaccinated if you're a doctor or a nurse?
Dr. David Peterman, CEO of Primary Health Medical Group, says about 30% of his staff are not vaccinated.
Given that this vaccine has been given to billions, billions of doses around the world, with very few side effects and incredibly effective, it is hard for me to understand why any healthcare worker, unless they have a medical reason, wouldn't be vaccinated.
Healthcare workers are humans too, with their own set of beliefs. But when they're the ones who are promoting getting vaccinated since it first became available, it may come as a surprise that even some of them are vaccine hesitant.
I understand there is some hesitancy among some people in the United States and healthcare workers. But it's hard for me to understand that when what we've been through is the worst epidemic any of us have ever seen.
Katie Quinn, safety officer and COVID-19 incident commander at St. Alphonsus Health Center, says about 70% of their healthcare workers are vaccinated.
So would you say you're a little bit surprised that this percentage isn't higher?
Not necessarily. I think our colleagues are really almost like a small community where you would have a percentage who actively wanted to be vaccinated the first day they could obtain it based off of the priority group they fell in. We have others, who wanted to talk to their provider and wanted to, get some more information.
Quinn says just like the general population, healthcare workers may have personal situations that make them deeply consider getting vaccinated.
We have pregnant colleagues or colleagues with health conditions where they really are working with their provider to understand what the best course for them in regards to the COVID vaccine.
Both Peterman and Quinn agree that the best approach to getting more staff vaccinated is education for now.
It's so nuanced now depending on the individual circumstances, which is why we're really trying to hit every piece of the puzzle of what people are thinking about.
But sooner rather than later, Peterman says making the COVID vaccine a requirement for staff could be a reality for some medical providers, including Primary Health, telling me it's more likely to happen once the FDA removes the emergency use authorization and gives vaccines full approval.
When you mandate getting a COVID vaccine for your employees, do you think you're going to lose some of them?
Yes. And I feel very strongly in that at Primary Health, decisions as relates to health care and protecting our patients, protecting our staff, we have a group of physicians who look at the evidence and then make a recommendation, and then we follow as policy. We do that with influenza vaccine, we do that with other vaccines like hepatitis, and I am prepared for us to do that with COVID vaccine, and if that means an employee wants to work somewhere else, then I support that. The obvious next step with coronavirus vaccinations is to make it a requirement of healthcare workers.
Okay, Katya, so that sounds pretty clear. Primary Health, it's just more of a question of when, that they will make it a requirement for their employees to get vaccinated. But what do the other health providers across the state of Idaho say?
Well, St. Alphonsus tells me they don't want to make it a vaccine requirement for their employees until their employees and staff are ready for something like that. So right now they're still kind of in the discussion phase of everything. And I heard back from St. Luke's not long ago. They too say they're not sure exactly what they will make, the decision they will make, going forward. Brian.
Well, and it also seems like if our goal as a country is to get to 70%, but only 52% of our healthcare workers believe in it and do it, it's going to be a tough go ahead. All right, thank you very much, Katya.